I'm good.
It's good to see you again.
Thank you. It's good to be here.
What can we do for you today?
Well, I've been hearing about and reading about something called the Veterinary Feed Directive, and I'm a little bit concerned because I do feed some baby calves, and I'm worried that I won't be able to get milk replacer anymore.
Okay, the Veterinary Feed Directive is new regulations, and I don't know a lot about it either, so maybe we could call Dr. Stucka and see what he has to say.
Okay.
Hi, Dr. Stucka. Hey, this is Katie calling from Grant County.
Hi, Katie. How can I help you?
Say, I've got a producer here, Yolanda, who is wondering about the Veterinary Feed Directive, and I was just wondering what you can tell me about that.
Katie, I'm glad you called because this is an issue that we need to communicate much better. A veterinary feed directive, in simplest of terms, is simply a permission slip that a producer obtains from his veterinarian to use in a certain fashion on a group of livestock. And once that permission slip is given, which is called the Veterinary Feed Directive, the producer takes that to his feed dealer and provides that feed dealer with the VFD, and then that producer is able to buy that particular product.
Okay, well, I guess I'm glad I called. Sounds like there's a lot to this. Does this mean that Yolanda's going to need a permission slip for everything she feeds then?
Well, Katie, we talk about feed additive medications in a broad stroke, but there are actually some exemptions to that regulation. Currently, the antibiotics that are targeted are ones that we call medically important, and you'll be able to find that list on the FDA website. We will actually have that website linked on our homepage as well. So when we talk about the products or the drugs that are included in this VFD, it'll be the tetracycline products, it'll be some sulfa drugs, but it'll be the antibiotics that are commonly used in livestock, and particularly in this case, cattle. It will not be some of the other feed additive medications that you can acquire, like the coccidiostats, for example. So there are exemptions, and you need to check with your veterinarian on which ones you can actually purchase with a VFD.
Okay, so what does this mean for me or for Grant County? What do we need to do?
Yeah, Katie, this is a huge role for Extension. This is a message that needs to get out to as many people, veterinarians, producers, backyard livestock owners, as we can possibly reach. Because come January 1, 2017, you will no longer be able to buy certain products without this permission slip that we call the Veterinary Feed Directive. So contact your local veterinarian, contact your extension agent, and they'll be able to help you with this whole Veterinary Feed Directive issue.
What impact are we talking here?
One of the important issues that goes along with this VFD is that you as a livestock owner, as a livestock producer, need to have what's called a veterinary client-patient relationship. And that just simply means that I know who my veterinarian is, him or her, that I depend on him or her for advice. He knows my operation, I know them. We have this professional relationship. And with that veterinarian then in turn can write me a permission slip, a veterinary feed directive, to use some of these medicated feed additives in my livestock.
So do you think this is going to be very difficult for people to adapt, or is it going to be something fairly simple once we understand what we're doing?
Once I think this is in place and we have a few weeks to kind of transition into it, I don't think it's going to be that difficult. I think much of this stuff will be done electronically. The veterinarian, or it may even be the veterinary staff, with the permission of the veterinarian of record, that'll fill out this form. It'll fill it out online. It'll be transmitted electronically. If the feed dealer does not have an email, you actually can fax this as well. I will add to that this veterinary feed directive cannot be transmitted orally. In other words, I as a veterinarian cannot call the feed dealer and say, please give Katie permission to come in and buy this medicated feed. I can't do that. I have to follow the rules. But I don't think this will be a burdensome issue for us. if we do it right and we're educated on how to use it. Thanks for the questions, Katie. Bye-bye.
There's